Hello everyone. My name is Amrit and I'm one of the junior doctors or clinical fellow or SHO in NHS. I'm working here for 2 years. The purpose of making this vlog is getting a job in UK or in NHS after passing your PLAB 2, because there are certain requests regarding please make a vlog. I have never made any vlog in my life. I just made short reels for Instagram. This is my first vlog, so I don't know how to fantasize it, but yeah, I'll just try to cover the main things. So many people are worried nowadays because of the job saturation, or because getting a job in UK has become so tough recently, and this is very true. The competition is very high nowadays. When I was applying 2 years ago, for one job maximum they were applying maybe 100 people, but nowadays they are applying for one job there are 300 candidates applying for one job, and there are less amount of jobs as well. When I was applying, the job numbers was high and the candidates were low, but now the jobs have decreased and candidates have increased. So that's why it's very difficult nowadays to get a job in UK. Why the jobs have decreased and why the candidates have increased, there are reasons for that. Why the candidates have increased? Because I remember exactly 3-4 years ago, all the people were crazy for USMLE. All the people were going for USMLE. So there were less amount of people who were coming toward PLAB pathway. But now all the people, because getting match in USA was very difficult, so they moved to the PLAB pathway. And so that's why the candidate number has increased. But why the jobs number has decreased? The real reason, which we have been discussing in groups, different IMGs group, that junior doctors are now being replaced by ENPs, by PAs, physician associate. I don't know full form of ENPs. Means they are not the 5 degrees. They haven't completed the 5 degree of 5 years of MBBS. They have just done some maybe nursing course. They did masters on that. I exactly don't know what they have done, but they are not the 5 years of MBBS degree. They have just done some course, and now they are being permitted to work as a doctor with some restrictions. So the junior doctors are being replaced by them, and there are definitely many benefits for that. The salary of them are very low as compared to the junior doctor, and they're not going on a strike like the junior doctors are going. But there are many other reasons, definitely. So that's why junior doctors' jobs have decreased, and numbers can increase. So it's very difficult now to get a job. Even I have 2 years of NHS experience. Still, after one contract, I still think whether I will get a new contract or not, whether I will get a job in NHS now this year or not. Like, see, my contract is going to end in August. I'm still thinking whether I will get a new job in NHS or not. What you can do if you have passed the PLAB 1, or if you are just thinking to intend to PLAB pathway, or if you have passed your PLAB 2 and you are not getting job, what you can do differently. So if you haven't started your pathway, I will again say, think about your pathway, think about your career. If I would be at your place, जैसे मैं होता, मे बी मैं भी 2 माइंड से काम करता कि यार इतने लोग जा रहे हैं, कुछ ना कुछ जॉब मिल जाएगी. That's also कि इतने लोग जा रहे हैं, जॉब तो मिल जाएगी, ऐसा नहीं है नहीं मिलेगी. That's also true as well कि जब इतना सारा जान चल रहा है तो जॉब तो मिल जाएगी. पर ऑन द अदर हैंड, मे बी मैं फाइनेंशियली थोड़ा स्टेबल होता तो मैं अपना करियर यूएसएमएल की तरफ जाता, क्योंकि सिचुएशन चेंज हो गई है. एज आई एक्सप्लेन इन माई प्रीवियस वीडियो कि वहाँ पर अभी मैच मिलना आसान हो गए हैं. पर अगर आपने सोच लिया कि आपको प्ले भी करना है, क्योंकि इसमें इतना वो नहीं ना सर का दर्द, रिसर्च पब्लिकेशंस ये वो जैसे यूएसएमएल में चाहिए होता है, तो अगर आपने सोच लिया कि हमें प्ले भी करना है, तो व्हाट आर द थिंग्स यू कैन डू डिफरेंटली टू गेट ए जॉब. तो there are many things you can do. When you come here UK for your PLAB 2, just make sure you do a 1 month clinical attachment somewhere. Although it's not like if you will do clinical attachment you will get a job, but definitely there will be a good chance you will be over the age than someone else. दूसरा, जब आप आओ तो आप ALS कर सकते हो. These two are very main points. मतलब न करने से कुछ करना बेहतर है ना, तो उस हिसाब से these two are very good points जो आपको जॉब में हेल्प कर सकते हैं. उसके अलावा आप क्या कर सकते हो, किसी भी रिसर्च में अपना रिसर्च कर लो, उसमें अपना नाम डलवा दो. The people who live in Pakistan, they can do research very easily. They can, because they can ask their colleagues to help in the research and everything. You can do audits in your home country as well. You can just find a criteria, and you can do audits. I will try to make a separate video for how to do the audits, but you can do audits, you can do research. Make sure to do the clinical attachment in UK and ALS from the UK. And what are the other things? Make sure when you pass your PLAB 2 and there's a gap between the PLAB 1 and PLAB 2, like for suppose there's a gap of 8 months to 10 months, because getting a seat is very difficult nowadays. So if there's a gap, of so much, like up to 1 year, even you can deliberately delay your PLAB 2 just to get benefit of the time duration. So just make sure, when I was coming to UK, I have never in my mind that what I'm going to do in future, whether I'm going into emergency medicine, whether I'm going to IMT, or whether I'm going into GP training, surgery. I never had idea, because I thought, okay, I will go to the UK, I will explore different fields, and then I will decide. But one good opportunity for you, just make your mind from now, whether you want to do emergency medicine, internal medicine, GP training, surgery, or anything, and give your basic exams according to that after passing your PLAB 1. For suppose you are doing IMT, so just make sure you give MRCP part 1 during this time duration between PLAB 1 and PLAB 2, or give MR Chem part 1 if you are planning to go into emergency medicine. Give what else, MRCS. So if you are applying, so that will also boost your CV. That will definitely give you an edge for above many things. And one other thing, so this is very good thing to increase your chances. What else you can do? There's the one best way which have recently many people adopted, have chosen, is directly entering into training. There are different trainings in which you can enter directly, but I know about GP, so I would advise you on that. Definitely there will be other specialties in which you can come directly as well. Like many people come after completing MRCP part 1, part 2 passes, and they enter into registrar post directly. Or many people coming after MRCS 2, and I don't know their theory, their Viva exam or practical exam. So they can come into a registrar post directly, which is comparatively nowadays easier to get. And for the GP training, you can get your crest form signed from your home country, and you can apply for MSRA from there and take it and enter into GP training directly. Is it a wise idea to enter into GP training, enter into any training directly without having prior NHS experience? Definitely not a wise idea, because as a junior doctors, you get many things to learn, you get into the system, and then you enter into training. But because there are less chances now, so you can enter. वो बोलते हैं ना, कुछ नहीं होने से कुछ होना बेहतर है. तो definitely we learn from the things. So when you will come here, you will definitely get used to the system. And even when you will take MSRE from your home country, you will score very much higher than the doctors who are already here. Because if I'm doing a 9-hour shift, I cannot study after coming home, because 9-hour shift is very draining shift. So, but if you are back at your home doing nothing, you can definitely score very high, and you can enter to GP training directly. Same happened with most of the people this time. There are 12,000 people who have passed the MSRA, and most of them are coming directly from their country as well. So yeah, this is one of the possible ways as well. I give MSRA this year and I got 455. 455 was very good score 2 years ago, because many people are coming to the non-training jobs. The competition was not very high. But this time 455 is nothing. Even I'm not hoping to get any seat anywhere. Even people with a score of 470, 480 are not getting any seats. So that's why the people from outside the country, they are applying directly into the training. I hope I try to cover many things, but definitely there could be many more things. And if you have any questions, you can ask in the comments, and I will try to make a separate video on that. And many people ask me on what is the pathway for Australia. From direct pathway to Australia, I don't know, but I know people who came to the UK, and now they have been shift. Now they shift. Now they have been moving, or they are planning to move to the Australia, because you can move to Australia after 1 year of NHS experience. So after coming here, you can definitely move anywhere. There are many different doors will be open for you, but getting here is difficult nowadays. So yeah, post your questions in the comments, and we'll see you in the next vlog possibly.